Hi, I'm Maddie,
I'm Ava.
And I'm Sage.
and today we will be talking about our effective ER design.
So the way that we wanted to kind of take this project as our own for the emergency room design concept was we were going to compare a non-trauma ER that's not certified for trauma, like the St. Vincent Carmel ER, to an ER that is certified for trauma, like the one we have here on 86th Street. So we visited both of them, and here's what we found out.
So just a little background information. The top reasons for ER visits in the United States, the first one is chest pain, and this is common in a lot of elderly patients. Next we have skin infections, and then contusions and cuts, broken bones and sprains, abdominal pain, back pain, upper respiratory infections, foreign objects in the body, headaches, and toothaches.
So basically, we wanted to do a little bit of preliminary research to find differences between trauma and non-trauma ERs, but we couldn't find a lot on the internet because ERs are generally they are generalized as trauma centers. So what we found out from asking the nurses at each of the respective locations was this, that there is a very big difference in the amount of steps that nurses take at each of the locations. At the St. Vincent location in Carmel, the nurse that we spoke to said that she takes about 10,000 steps a day, whereas the nurse at 86th Street said that she takes around 19,000 to 20,000. And also, even though the St. Vincent at Carmel ER is very small compared to the 86th ER, their wait times are a lot shorter and their environment is a lot quieter than the 86th Street ER, which can have a maximum of 20 to 30 people in the waiting room at a time, and people are constantly flowing in and out, and it's a very loud, hectic environment. Also, as the 86th Street ER is certified for trauma, they have to have extra equipment such as mobile trauma carts and special trauma teams that will take care of patients in dire situations. When we spoke to the nurse at 86th Street, she did tell us that even though there is a lacking availability of open beds sometimes at the 86th Street ER, it's easier to work in a smaller hospital. It's easier to work in a larger hospital than a smaller hospital because there's more general availability of resources. And then another structural note about the comparisons between the two is that there's a separate trauma waiting room at the 86th Street ER, and there was not one at the Carmel ER.
So we also looked at some safety procedures at both St. Vincent and 86th Street. However, 86th Street had the most updated procedures. So at 86th Street, they had bulletproof glass on the outside windows and in front of the reception desk to prevent, in case, say, a patient passed away and a family member blamed one of the doctors, that glass is just there for precaution in case someone did bring a weapon. There's also strategically placed concrete planters in front of the entrance of the emergency room. That's to prevent anyone from driving cars up and through the front walls of the ER. And the ER in 86 is also kind of situated up on a ramp to further prevent that as well. They also have multiple security offices. They have one main office where there's like a very visible sign to kind of lure anybody that would be trying to attack someone to that office so they can be taken care of. And they have like video cameras in there to watch patients coming in and out. And they also have a security office on the side of the entrance that has one-way glass. So it's really hard to tell that anyone is in there. That's just another safety precaution in case someone did come in with malicious intent. They also have the trauma waiting rooms, like Sage mentioned before. Those are just for families of patients that are classified as trauma. It not only protects other people in the waiting room, but it allows those family members to have a safe space to just kind of deal with what's going on. And then they also have panic buttons and certain emergency buttons around the front area to make sure that either receptionists can alert security to like a dangerous situation, or patients in the trauma waiting rooms can easily leave those rooms in case there were an emergency happening.
Okay, so next we'll look at the improvements. These were made specifically for the 86th Street ER because we were looking to see what the Carmel ER would need in order to become a trauma center, and then these are the improvements we made on top of that. So the first improvement we were thinking of making was creating a lab within the ER. So currently, most ERs, do not have labs in their ER, so they have to wait for test results to come back, and they also have to take into account the travel time that it'll take for them to walk to the lab and then back to the ER. And this wastes a lot of valuable time where a lot of patients may simply just be waiting in a bed for a test result. And they're taking up the bed that a sick patient may actually need. So by putting a lab inside of the ER, ER doctors can just simply take the test and put them into the lab, and then they get the results probably within 10 minutes, which will help to reduce the wait time. And then next was creating a separate discharge waiting room. So also going back to the problem of a constant flow in the ER. So a lot of trauma centers, they do get backed up because they have to drop everything when a level 1 trauma would come in. And then they have also a lot of patients sitting in beds waiting to be discharged, but they may get caught up with a trauma, and this patient may be sitting in the bed for hours, not really needing to take up that space. So by creating a discharge waiting room, they can take these patients that are capable of being disconnected from any IVs, and they can put them in this waiting room until their discharge paperwork is done. That way it can free up a bed space for someone who needs it. Next would be implementing radiology equipment that's specific to the ER. So right now the ERs, they have to wait for like X-ray machines and CT scans, and they're like lumped in with all other hospital patients. So they have wait times of up to 3 hours, and they often have a lot of overflow just sitting out in the hallway in their beds just waiting to go in for their scans. But if we put a CT scan and X-ray machines directly in the ER that are specific to ER use, then that way it'll cut down on the wait time for a scan and help get them diagnoses faster. And then next was putting more beds and getting a faster turnover time. So if they had more beds, they would be able to get more patients in and out, which would greatly cut down on the flow problem. And then lastly was putting a receptionist and a nurse at the front desk, because right now they only have the receptionist putting in the information. But if they had a nurse stationed at the check-in desk with the receptionist, the nurse would be able to hear all the complaints that the patient has and would be able to help speed up the check-in process. Okay.
So in conclusion, at St. Vincent Carmel, they don't really have many issues with their size and the flow due to the small stature of the patients that come in. So the nurse that we talked to believed that the hospital was well equipped to deal with the amount of patients they had daily. They also believed that the size of the hospital was very adequate. The only issue they had was the lack of triage, which they actually fixed last year. So at this point, St. Vincent Carmel is running very smoothly. However, at 86th Street, the nurse we talked to had a few complaints specifically about the flow. Like we talked about before, by implementing those previous problem solutions, we could help to speed up that flow. So for example, she said that the lab was just so inconveniently placed that the time taken to get those tests was just kind of crazy. And then there also just a general lack of supplies to cater to all the patients. She also stated that rooms were often overbooked for long stays, similarly to how Maddie said that like they're waiting for a test, but they're in the bed taking up that space for another patient. And then again, that lack of scanning machinery for the ER. So if we could take these solutions that we came up with in the last slide and implement them at 86th Street, not only would it improve the speed of patients going through the ER, but it would improve the patient stay and their experience with the hospital in general.
And we had a very personal experience with some of these wait times and some of the obstacles that are faced with not having a lab and not having enough resources available. When we were at the 86th Street ER, we were expecting to meet the nurse that we were talking to right when we came in, and it took about another 30-45 minutes before she could get there because 2 intense trauma cases came in right when we came in. So it was definitely pushed back, and we were able to still talk to her and get a lot of good information, but that showed how long the wait time can be for just a few trauma cases. And also when we visited the one in Carmel, we walked into the nurses discussing how the lab had said they were going to send them results hours ago and they had still not received results. So all of this could be fixed by just a few implementations.
And then we have we're excited. All right.
Sweet.
Bye, Harper. Have a
See
good
ya.
break.
Don't get corona.
Wash your hands.